Thank you all for tuning in. I'm joined today by Dr. Athreya. He is a board certified physician in Atlanta, and he has a very exciting announcement today about a new project that he's launching, for lack of a better term. And I would like to welcome Dr. Athreya to the podcast. Welcome, Doc.
Thanks, Sandeep. Really excited to be here. Really looking forward to the chance to talk.
Perfect. Let's dive right into it because I've got a lot to cover and I'm super excited. Now, you're an MD and a graduate of the American College of Lifestyle Medicine. That's a mouthful, man. But can you share with us what initially drew you to medicine personally? And then what prompted the shift to focus more towards lifestyle, if you will?
Yeah, I think that my path to medicine is a little bit different than most doctors. Um, Coming out of college, I really wasn't sure that I was going to go into medicine. What I did know is that I wanted to make an impact with my community and learn about how I could help. So I actually worked in Ghana for 6 months and then India for 6 months and then worked for AmeriCorps. And what I learned during that time is that there is so much that influenced our health outside of just what doctors prescribe or what surgeries you can do. And I think that really changed the way that I looked at medicine. Um, I ultimately figured that the best way I could use my skills was to go to medical school, but I think that foundation of community health and how do we get back to the fundamentals of healthy living was always in the back of my mind as a practitioner. And I think recently had the opportunity to pursue a certification in lifestyle medicine. Um, and the concept of it is that food is medicine, that
Mm.
we can really make a huge impact on what our lives look like by just thinking about how we're living our lives day to day.
It's very interesting. You know, it's first of all, kudos to for you to put yourself out there and try to help with with countries and social structures where there's more help needed. So, for example, in Ghana or in India for that matter. What was it like living in those two countries? And even with AmeriCorps, obviously the mission that AmeriCorps drives to is more social benefit rather than a for-profit organization or anything like that. So what was it like working in these different settings? Obviously, Ghana is completely different than India. Is completely different than probably what you did in America. Or so talk to me about talk to me about those experiences.
I think when I think back on my time there, what the first word that comes to mind is simplicity. I think we were working and living in a community where we weren't constantly bombarded with ads. We weren't constantly stimulated with TV or anything like that. So it was very much about like the people that you were around. And it wasn't necessarily easy to go from point A to point B. There was a lot more walking involved. There was a lot more relationship building. And I think the food that we were eating was just a lot more homemade. We weren't eating out as
Mm,
much. And when we were eating out, it was with less processed food. So in general, you were eating better. And so I think you could see that people were generally happier and generally had like better health.
yeah. So did you uh did you bring some of those learnings that you talked about, right? The cultural nuances, the fact that some of those older cultures in Africa or in India, they do things differently than what we're used to, obviously here in our American society. Did you bring some of those learnings into the new venture that you're launching? And if so, how did that connect in your head to say, man, you know what I learned over there, these two, three things or four things or five things, I think they're directly related to the impact that I want to have with the new initiative that I'm launching?
Um, I think there's two main lessons I think that really stuck out. I think one, those experiences made me a better listener,
Mm.
especially being in a foreign place to me, to be able to get by, to be able to answer the questions I was looking for, or to even help. I had to figure out how to be a good listener and an empathetic listener to the community that I was a part of. And I think I bring that to my practice now, or anytime I try to help someone solve a problem. It's trying to take my own agenda out and then really listening to what the person's going through or what the problem might be, and then kind of constructing a plan together. I think the second idea, throughout history, we always think that we have the answers to everything science related, but in reality, history shows us that we don't always know how everything works. And I think opening my mind to alternative ways of treating people with health conditions, or even like complementary types of medicine, I think led me down a path now where I think it led me down a path now where Western medicine truly is really important. And I take a lot of pride in being evidence based. I think we don't talk about enough about what you can do to improve your health without using pills or like procedures or injections to make yourself better. And I think that made me pursue a lifestyle medicine certification more than anything else. Is how do I help people who don't want to use 9 different pills to
Mm.
try to get better?
Mm. It makes sense. Makes sense. So let's talk a little bit about the new venture that you're launching, the new company. I know you and I discussed earlier, and the name is Healthy Rewire. So tell people a little bit more about what is Healthy Rewire about. What's the story behind it, and what are you hoping to help people rewire? For lack of a better term.
Yeah, I think right now I'm a full-time practicing family medicine doctor, and what I'm seeing is that patients are coming in and they're kind of overloaded with information that they might get
Mm.
on the internet or through TV or talking to people on social media. People are confused about what works, what doesn't work, who to believe, who not to believe, and I think it's really justified. I think that traditionally the healthcare system is broken. I think very it's very real that some doctors do try to manipulate patients. They do try to take advantage of uh, the financial benefits that they can get from treating patients. So I think, understandably, a lot of patients have mistrust.
Mm.
So the idea around Healthy Rewire is, given all this chaos, why don't we just take a step back and reset and kind of go back to the fundamentals of what can help people live a long and healthy life and make people feel confident about their bodies and confident about how they feel. And so Healthy Rewire is about, one, going back to the fundamentals of good health, which comes down to eating, managing your sleep, managing your stress, having good social relationships, and avoiding risky substances. Um, and I think that the rewire part is that while we want to go back to a simpler time, the, the reality is that we're living in an age of technology, and how can we use that to better ourselves and use it to our advantage? And I think what's really exciting is when we can use AI to do the annoying stuff that we don't really want to do, like track the food that we're eating. My wife does a great job of tracking her own food. I hate doing it. But if I had something to help me do that for me and I didn't have to think about it too much, or just give me real time feedback about the plans that I think should work to make me stronger, faster, whatever, it'd make my life a lot easier. And I want to be able to share that with patients.
Yeah. It's interesting you mentioned that making it easy, the annoying stuff, and I love the way you phrased it. The way, and this is rooted in human psychology, right? The more friction you have to do something, and it doesn't have to be just physical friction, right? It could be friction generated that focuses on a time constraint or cognitive load or emotional state, whatever the case might be, right? The more friction you take out of the equation to do something, the more likely people are to follow, right? And that's true for kids. I mean, I've got two little kids, and it's true for them as well, right? My 13-year-old, anytime I'm asking him to do something, if he feels that there is resistance to him getting to the point where he needs to, he's not going to do it, right? So I got to figure out a way, or he's got to figure out a way in most cases, how to take care of that sort of that friction. Same with my 10-year-old, right? When I'm coaching their teams, it's the exact same thing on on their day-to-day lives. But then it translates to our us as adults and how we live, for example, right? So hey, eating healthy is great, but what is the resistance to getting to that eating healthy part? Starting with knowledge of what to eat to begin with, specific to me as a person, right? Not just specific to you or a population, but specific to me. Can I get access to that food? It's great that you want me to eat healthy, but if I don't have access to that food, you're just giving me advice that is pointless. I mean, I use this term, useful but pointless, right? Pretty much that's what that sort of information is, right? So I like the fact that you said that, hey, the annoying stuff, if it can be taken care of, it removes the friction, it removes the resistance to sticking to it or even starting down a path, and that would certainly help.
Yeah, no, I mean, to your point, like the friction is what's keeping us from building habits. And if we can take that away and make it easier to build healthier routines, I think we can see a lot of progress. And I think the other part that I'm excited about is a lot of times when patients come in, we talk about what goals might be, but we don't write them down concretely, or I can't give them feedback
Hmm.
in how they're doing fast enough. But if we have a AI agent who's there to show you how you're making progress and maybe not what you identify as like your main goal yet, but some of the other like subsequent benefits that you're seeing by making healthy changes, and then your main goal also improves. I think that reinforcement and seeing that continued change encourages a lot of people.
Yeah, yeah, I agree. I agree. So now you mentioned earlier, we talked about the American College of Lifestyle Medicine. So your approach is obviously deeply rooted into that sort of a paradigm, the lifestyle medicine. But for a lot of people, there's still confusion, right? They don't understand, or they might inhib at a surface know the difference or what lifestyle medicine is, but they don't truly understand the difference between lifestyle medicine versus conventional medicine, where they might overlap, where they're completely divergent. Can you give our viewers and listeners a sense of the comparison between lifestyle and conventional medicine? And again, are there points where they intersect, and then there are points where they're completely unique?
Yeah, I think there's definitely some overlap, but I think like there are some fundamental philosophical differences on
Mm,
how to approach a patient that comes to you asking for help. I think in the conventional sense of medicine, you might hear doctors tell you to eat well, to exercise, give you like general recommendations that to your point is useful but not helpful because it doesn't help you actually build out that structure. I think in a lot of cases that they say that because they truly don't know what to say beyond that. And from pulling the curtain back a little bit, doctors aren't really reimbursed to tell you more than that, to use their time. But what they are reimbursed for is trying to grade how severe your issues are and then provide you with the appropriate procedure or maybe a medicine. Um, and I'm not saying that doctors get kickbacks for prescribing you different medications necessarily, but I think that it corresponds to like a higher level of care that
Mhm.
companies can then bill for and then bill you.
Mm.
I think the main difference in lifestyle medicine is we still strongly believe in evidence-based care, especially for patients who have conditions that have gone way to the deep end and are really sick. Like I'm never not going to prescribe a medication if I think it's the right thing to do or it's going to keep someone safe. But the fundamental difference in lifestyle medicine is that we try to start with the building blocks of what you're doing in your day to day and show you how exercise and the food you eat is related to how well you're going to sleep that day or like what your mood is going to be like and let you feel what your body is telling you a little bit more and help you build the habits to make you feel better most of the time. And what really excites me is that through lifestyle medicine, you can see how if you are able to start early enough, you can reverse things like diabetes, high cholesterol, heart disease, things like that. And then you don't even need the medicines. Sometimes when you're on medicines and you're able to make those changes and then stop the medicines, that's to me the most exciting part of my job.
Mm. Got it. Got it. Now, lifestyle medicine, based on a little bit of research that I was able to do, the ACLM, American College of Lifestyle Medicine, it bases its core structure, its core philosophy on six different pillars. Can you talk a little bit more about that, and how do you get to the root of using those pillars of where a person needs help, where they need support or guidance, for example?
Yeah. So the six pillars of lifestyle medicine are sleep, stress, food, exercise, substance use, and social connection.
Mm.
I think in any general intake that I do with patients when I'm getting to know them, you kind of cover all six of those um, because I'm interested in more than just what your medical history is, but like how are you actually living your life with your family and friends? To be able to tease out which to focus on, it's kind of comes out when we start talking, and most of the time, patients know. They know what they're not doing or what's bothering them the most, and then I think it's about just setting healthy, reasonable goals for them to change that, and I think with Healthy Rewire, the benefit is that I'm not trying to be everything for you. We have professional coaches that are able to help build those goals in a actual evidence-based way so we can see the change that people are setting out to achieve.
Yeah, I love the comprehensive nature of those six pillars, if you will, right? I mean, the social connection, the substance abuse, the sleep and stress. I mean, those are not the everyday things that people think about when it comes to overall healthy living or overall healthy lifestyle or clinical sort of path to success. But over and over, evidence keeps popping up that says no, those are important contributing factors to a person being healthy or otherwise. So I love the fact that it's pretty all inclusive. Now, if I understand correctly, your initial focus is on pre-diabetes and type 2 diabetes. Why did you choose to start there, and what are the potential impacts of a holistic approach, a lifestyle approach that you just mentioned, for example, on those two specific conditions before they become chronic or at the point where they are chronic?
Why I chose to focus on people who have trouble with their insulin resistance or sugar control. I think to me, it's one of the conditions that kind of sneaks up on you.
Mm.
There's when someone has prediabetes, or early stage like diabetes, they may or may not take it seriously,
Mm,
and they're not going to see the ramifications of that for like years at a time. And I think having worked downstream and seen people lose limbs or have heart
mm,
attacks or hate being on insulin or end up on dialysis, I think the only thing I could think of is this could have been prevented so easily if we just had a talk early on about what changes you can make to your day to day to avoid like all this pain and suffering. And so I think I take a lot of joy in helping people stop medicines after seeing the changes that they've made through changes in their diet or exercising more or getting better sleep. Um, and I'm really excited to help more people do that.
Perfect. Perfect. Now, let's say a patient walks in through the door, right? And it's a new patient for you that is going to use Healthy Rewire as their sort of the path that they'll follow to get healthier. What would that journey look like, the new patient coming in, and what sort of impact do you expect them to see, or what does the experience look like over the next few months, for example, and sort of the results that they can. I mean, obviously, there's a lot that has to happen behind the scenes for results to show up. But what can they start expecting to see once they join Healthy Rewire from coming in to a few months, fast forward to a few months after that?
I think the first thing I want to do is make someone feel comfortable. So I think a lot of that conversation is just about trying to get to know you
mm,
instead of just treating you as like a health problem. A lot of doctors just think of patients as like a diabetic or someone who's pre-diabetic instead of Sam or Tom or anything like that. And so I really enjoy just getting to know what people do, how they spend their day, what's important to them, what they wish they can do if there's something that's limiting in their day. Um, or a lot of times you hear about patients say, like, I used to be able to run X
mm,
many miles, or I used to be playing whatever. And I think to be able to try to get some of what makes people feel like themselves or back to feeling happy is a primary goal. I think in that first meeting, we're going to run through all of your medical history. We're going to learn about what your experience has been with the health system and make sure that when we're working with you, we're keeping you safe. But then we're going to set goals that are not overwhelming. And we're going to chip away at the change that we want to see. And it's not going to be just me, it's going to be a team of in coaches for whatever the goal might be, as well as AI to make sure that we have the data and you can see the data of how you're getting better. I I think it's a really simple change. Even showing people through a continuous glucose monitor, what different foods do to your sugar levels can be eye opening, and I think like really transform people's lives. And I think with Healthy Rewire, we have the ability to show people what their actions are doing to their body, and I think really make a difference.
Awesome. Awesome. So Dr. Hari, you mentioned a little bit about Healthy Rewire on what the patients should expect and the way you're going to approach them as they come in. If I'm a patient walking in and I just have one question like, "Hey, what is the program? What do I get?" How would you explain that to them on that answer?
Yeah, um, I think you get a really unique experience. I think you would get me obviously as your primary care doctor, and we would meet about every month. We could space it out to every 3 months, depending on how we're going. But I think what is really different is that you're going to get a whole care team as well. So that includes working with one of our nutritionists, one of our behavioral health therapists, one of our fitness experts to give you like a well-rounded, comprehensive health plan. And then honestly, when I think of lifestyle medicine, I think about those 6 pillars, but the problem is I've never seen a way to track everything in an
Mm.
efficient way, but I think what we're able to do is help take that legwork and that annoying detail work that you have to do to stay healthy out of the picture, and so to for instance, you can use our app to take a picture of the food you're eating, and it's gonna tell you exactly what the macros of that is and then log that for you with the rest of your day. You can even use it to look at the menu of where you're gonna go out that night for food and, like, make a better decision about the food that you're about to eat. Um, it wraps in tracking data around what your sleep score is gonna look like, what your stress levels are. It also comes with a, um, scale that measures your lean body mass. So a lot of times when you go to the doctor, all you get is a BMI, but we know that the BMI is not the best measure of
Mm,
someone's actual health. So I enjoy getting more accurate data there. And that's not to mention the CGM as well, where in traditional healthcare, you have to have really bad diabetes for an insurance company to even cover that. But with us, you're able to get that included in part of the package. And I think that's really is what's going to help people make the changes in what they're eating because they're going to actually see a direct correlation to what they're eating and what their blood sugars look like.
Got it. Yeah. So Dr. Hurry, we've talked a lot about lifestyle medicine. We've talked about the holistic approach. You just mentioned a little bit about a healthy rewire where you have a team of individuals supporting a patient. You have you obviously involved, but there's still a lot of myths, misconceptions about lifestyle medicine, holistic approach. What are some of the ones that you hear and you go, damn, that's not even close to being true?
Yeah, I think we're in a time in society where there's a lot of alternatives to medicine right now. I think that traditional medicine has its flaws, namely fee for service medicine doesn't have the right incentives that actually cares around about the patient. I think the nickname that I've heard is that it's actual sick care. I don't really have a problem endorsing that. I don't want to say that. I don't blame people for calling traditional healthcare sick care. I think that we shouldn't be reimbursed for every little thing that we provide to a patient. We should be reimbursed for trying to keep people healthy and happy. Um, I think in the last couple of years, functional medicine has become more popular, as well as more Eastern style of medicines. I don't know enough about either to talk about specific therapies and whether they can do the things that they purport to do. But I think if I was trying to summarize what lifestyle medicine is that it's food is medicine. I think that what we are trying to do is keep things as simple as possible. Um, as a PCP, if we need to prescribe medicines, if we need to do labs, like happy to do that, especially if we think that it's a piece of your health that'll help keep you safe. But my goal is not to prescribe supplements. My goal is to really do the opposite. I know that there are clinics out there that are telling you they're going to make you feel better by giving you IVs or injections or pills or supplements or a number of things. And then they're going to charge you for every little thing that they do. We just want to simplify your day to day, in that we want to help you build healthy habits that's going to last you a lifetime instead of being dependent on something month to month.
Mm.
Do
Good.
you want?
No, no. Yeah, I'll take it. I'll take it. I think we'll combine it with some of your other answers, and I think that will become more comprehensive. You already covered some of those. Now, remember what I was going to ask you, and this is where we can use a little bit of your help too on this. So, GLP ones, obviously, the big conversation and all, right? So, the next question I'm going to ask you is, a obviously pre-diabetes, type two diabetes, even weight loss. GLP ones have become very, very popular, right? What are your thoughts around that? And especially the fact that it's getting such popularity, and if possible, I want the answer to revolve around, and this is the approach we're taking to it, so making I'm not asking you to say something that we don't believe in either, which is that GLP-1s have a place in clinical care, right? There are people that absolutely need it, and I think they should get it immediately. They should talk to their doctor, get on the right dosage for them, and so on and so forth. But there are patients that are going through massive side effects, right? So they need to figure out how can they minimize, mitigate, or manage those side effects. And the best way to do that is to be able to figure out the right sort of nutrition that helps them manage that, or the right sort of workout plan, so that way they're not having muscle loss or fatigue and things like that. And then there are people that, before you go to GLP-1s, you should try something that is more, again, holistic, because it's more sustainable. It's something you're going to stick to because it's easier. It's, obviously, and it's cheaper. And it is something that is part of your everyday life rather than the disruption of putting GLP-1s and dealing with all that. So that's sort of the picture that we are painting to everybody, is that if you need a GLP-1, please go get it. Don't wait for it. But don't let that be your first plan of attacks, your first course of first action. Let that be, hey, I've tried truly, and here's the approach that I've tried, and now I'm going to it or manage the side effects. Does that make sense?
Yeah.
Okay. All right. So um and you can, I think you can even weave in healthy rewire in that,
Yeah.
hey, if you are using GLP-1s, or if you are struggling with it. Now, if I have a patient, I, as a Dr. Hurry, if I have a patient that comes to me and I absolutely believe they need GLP-1, or their clinical markers indicate the need towards GLP-1, I will prescribe the GLP-1. But, and it's a big but, that have we tried everything else? What have we done? Have we understood? How can we manage the side effects if you're on it? All that is an important part of the equation. Okay. All right. So here comes the question. So, Dr. Hurry, excuse me, in the over the last 12, 15, 18 months, the class of drugs, the GLP-1, has become very popular. I know in the US and even international markets, GLP-1s are becoming more popular, and people using it for diabetes, people using it for weight loss, and a multitude of other areas. What is your approach? What's your thoughts around the use of GLP-1 drugs, and the gain in popularity and access to the patients?
Yeah. I mean, overall, I think the public knowledge of GLP-1s is great. I mean, GLP-1s have been around for decades, but they are having a season right now. And from a medical perspective, I think they do wonderful things. Like, we know for a fact that they can help reduce the risk of obesity related complications with renal disease or cardiovascular disease. I think they're really effective in helping people manage diabetes. I think there's no reason to say that I'll never prescribe GLP-1s. I think that where I believe people can run into issues or not even maximize the full potential of the medication is if they don't use a comprehensive approach when they're using GLP-1s. I think the idea that a GLP-1 protects you from everything, or it's a magic injection or now pill that excuses eating fast food every day or making poor choices at a restaurant or not getting in a couple of walks per day or doing some resistance training, I think is false. I think what I worry about is patients who use a GLP-1 like Ozempic and then are eating foods that are cholesterol laden or saturated fat laden. And so now you get closer to a concept of like skinny fat, where where your arteries are still clogged. You still have the same risk of a heart attack, but you might not think of it that way because your scale doesn't tell you that. I think we're not 100% sure what the long-term use of GLP-1s actually looks like because we haven't had enough time to see what that does, but we know that it does cause muscle loss, and so I worry, especially in people who are older, about the risk of osteoporosis or having a fall um, really impact the rest of their lives. But I think even on a fundamental level, like I think society has grown up around food and sharing nutritious full food. And wonder um, if by turning off our drives to enjoy food, if we're losing something about having a shared sense of community around food. And I think everyone has a decision to make if they want to not have that hunger drive. And for some people, it's really loud, and it's more understandable. But I think the ability to share good food with people that you care about is one of the great things about life, and I want to be able to help patients enjoy that and be conscious of what they're eating. I think that GLP-1s can be pricey for some people, and I just wonder what else we could be spending that money on to make you feel like you're getting good food during the course of a month, whether that being enjoying a gym membership, maybe even going on a vacation. Um, is the GLP-1 the best way to use your money um, to live a holistic life?
Got it. Got it. So Dr. Hurry, this has been great. I think people will learn a lot about obviously what you just talked about, lifestyle medicine, and congratulations on the launch of Healthy Rewire. To us, it looks like it is a unique blend of the human side as well as the tech side to impact everyday life of people and give them the tools and the knowledge to make better choices. Tell our viewers and our audience, how can they connect with you? How can they find you and Healthy Rewire?
Yeah. So for right now, I think the easiest way to try to find us is by going to healthyrewire.com, or you can find me on LinkedIn. My name is Hari, Hari, Athreya, Athreya. We're still working on setting up our social media presence, so stay tuned on the website for more information where to find us there.
Perfect, man. Those things are always always tricky, the social media stuff. Okay. Now, if this is personal to you. If you could talk to the younger Harriet, you're obviously young, but if you could talk to even a younger Harriet Rhea, what would you tell him?
Everything works out. Believe in uh, the fundamentals of health, like you do.
Perfect, perfect. Well, Dr. Hari, it was a pleasure to speak with you. I'm sure our listeners are going to get a lot out of this conversation, and we look forward to having hearing more of you. And wish you all the best in the launch of Healthy Rewire. I to me, it sounds like it's a unique approach, and we wish you all the success. And I'm sure it's going to impact a lot of lives in a positive way. So thank you for your time.
No, thanks for having me, Sandeep.